Well, it's a common condition that can cause your finger to stiffen or freeze, and it may straighten suddenly with a snap. So if that sounds familiar to you, well, you may have trigger finger. And this morning we have Dr. Michael Kim back in the studio with us, getting us more on how you can treat this common hand condition. Good morning, Dr. Kim.
Good morning. You may be wondering why I'm talking about a hand condition, but I did a fellowship 1 year in hand surgery. And so either plastics and orthopedics can do a fellowship, take a test, and become certified in hand surgery. So number one, it's important if you have a hand problem, it's probably best to go to a hand surgeon, not just any doctor. Make sure they're fellowship trained so they have expertise in this condition.
I would think it's intricate. I mean, so hence an entire year on top of your education.
Right. So a trigger finger is very common. You know, it's amazing that some patients come in and they've been seen by their primary doctor and they say it's just arthritis or don't worry about it, nothing I can do. And they have a condition called trigger finger where the finger gets stuck, hurts, usually in the morning, right in the pulley. And just snaps and locks up in the morning, can last for months and months. The fingers normally have 5 pulleys. 1, 2, 3, 4, 5. The one pulley is where we're always grasping and putting a lot of pressure on. So the theory is that the trauma in the area can cause the pulley to thicken.
Okay.
So then the tendon gets stuck.
I see.
And I actually have one.
You have one?
Yeah, it's been killing me. But so the pain is down here and the snaps. Sometimes it doesn't even snap, just hurts. Hard to open your fingers. It doesn't always snap. Patients are usually, believe it or not, women is more common, six times more common than men.
Really?
Diabetics are more common, 10%, but we don't really know why.
Interesting.
Luckily, there's a relatively simple treatment. One is splinting. You can splint the finger and rest it. And over 60% of people get better with that.
So it'll basically extend it and eventually stay that way?
Avoid the motion in the pulleys, so let the inflammation go down. 2 is a cortisone shot.
Okay.
So a cortisone shot has anywhere from 50 to 70% chance of getting rid of it for more than a year.
Okay.
I'm very conservative. The surgery works great, but it's about a 90% success rate. That means 5 or 10% of people have issues with stiffness, swelling, and they wish they never had the surgery. So I try not to operate, so I'll give up to 3 shots. Some surgeons give 1 shot. There's no right answer, it's just my philosophy. And most patients get better without surgery. If you need the surgery, it's a relatively simple fix. That pulley is very thick and tight, so the tendon is getting stuck.
Right.
So you just make a little incision. I do it awake on the local anesthesia. And just open up the pulley so it doesn't lock anymore. It's about a 10-minute operation.
Wow.
Patient can drive home. 90% of patients do fine. The other 10% will have issues, have to go to therapy, etc. But it's a very successful operation.
So how do you know if it is, in fact, just arthritis or, stiff hands versus something that needs medical attention?
Well, it's kind of hard sometimes, but if you have the snapping or locking, usually it's a trigger finger. If it's just pain in the palm, it's amazing, though, how debilitating that could be. So a simple shot of cortisone is very, very helpful in those patients where the tendon is not getting stuck but just hurts. Hard to grasp things. In the morning, it's hard to open because the tendon is having a hard time going through the pulley. Very, very common. About 2 or 3% of the American population have it.
Wow.
So it's pretty common. I've had 3, and they've all gone away.
Being a surgeon, I can imagine.
They've all gone away with a shot. I probably need to get a shot today. Several of my partners also had trigger finger. It's a very common problem.
So what causes it? I guess I'm
They don't know.
assuming
They've
because
done
you
a lot
use
of
your hands a
studies.
lot.
They've taken pieces of pulley. They think that something happens to the pulley to get thick and narrow. Where there's repetitive trauma, where there's diabetes, where there's some other medical conditions. But ultimately, it's just the pulley. When you operate, it's very thick and tight. So once you open up the pulley, the tendon slides back and forth, and then the patient's better.
Okay. What is the one thing you wish people knew about hand health, given your expertise and background in it? I know you see a lot of patients coming in with hand issues.
Well, 1, be conservative. Beware of, just like cosmetic surgery, 2, beware of anyone who wants to operate right away. I think there are very conservative measures for a lot of conditions we see. Therapy, splinting, injections, etc. Once those fail and it's debilitating, then you need some type of surgery, whatever the condition is. But I always say it's always to try conservative management first. A lot of my patients can avoid the surgery.
Okay, good to know. Dr. Kim, thank you so much. We always appreciate you coming in. And we'll put a link to Dr. Kim's office and the services and all of that stuff on our Gulf Coast News app. It's a great thing to download. It's just been updated, so check it out there.